Arianna Zabriskie. I'm with IAU College. I'm the student advisor there. And this is my presenter here with me, Jessica.
Hi, I'm Jessica Hornbrook, and I'm presenting today from the University of San Diego, and I'm a clinical psychologist and student wellness.
Okay, so to get started, I want to go ahead and talk about the increased need for mental health care in U.S. universities here in the States. So to start, an article published by the American Psychological Association, they state that the overall number of students with serious mental illness is on the rise. So this trend started in the 1990s, where there was a reported increase in students seeking counseling services on their campuses. From year 2000 to 2010, the National Survey of Counseling Center Directors saw an increase in clients with severe psychological disorders from 28% to 44%. So this is a 16% increase in just 10 years. So the most common disorders are depression, anxiety, suicidal ideation, alcohol abuse, eating disorders, and self-injury. In 2010, the National Survey of Counseling Center Directors reported a 24.3% increase in patients with eating disorders, a 39.4% increase in patients with self-injury issues, and a 45.7% increase in patients with alcohol abuse. So overall, 1 in 5 adults have a mental health condition. So this comes out to around 40 million Americans. But with youth mental health, rates of youth depression has gone up since 2011. So it's gone from an 8.5% to, in 2014, 11.1%. And 56% of these Americans actually do not have treatment or receive treatment at all. So I'll let Jessica talk a little bit about that.
Right, so we're also seeing similar trends on our local universities. So in 2014, we did the NCHA data, which is the National College Counseling Center data, and 6% of our student population actually endorsed suicidal ideation within the last year. So this is really important to remember that these students are really facing many factors before even thinking about going abroad, so they need to be evaluated prior to their preparation and their continuity of care. Also, we're seeing about 21% of our USD students are endorsing anxiety as a major impact to their academic abilities while they're at their home institutions. So again, important to think about as we're helping prepare them for success while abroad.
So first I want to talk about the natural influx of emotions when going abroad. So I'm sure we can all attest that there is some level of natural influx of emotions that one will experience when they immerse in a new culture. And we label this in several ways. So probably the most common way we label this is as the U curve or the W curve of adjustment. So these adjustment models have evolved from the culture shock concept, was developed by Cora Dubois in 1951. These trajectories are helpful to show how stress can impact emotions. So the U curve, which was developed by Leisgard, describes a honeymoon phase in the culture shock, which is when the student first arrives abroad, and then it eventually matures into recovery and adjustment after the culture shock phase. Now the W curve, which was proposed by Gullhorn, is to account for the culture shock and the adjustment phases when the student returns home. So this is also known as reverse culture shock, which is also very common. So here's the U curve. So you can see the honeymoon phase. That's when they first arrive in their new culture. They are super excited to be there, and then right around the middle of their time abroad, they might experience the crisis or culture shock phase. So this is when they're feeling sad or depressed or maybe missing home a lot. But then eventually they adjust out of it and they adapt to their surroundings. And this is what we consider somewhat normal and natural, and we even prepare students for this change. So this is just outlining that again. So honeymoon phase, positive, happy, they're really excited to be there. And then in the crisis, this is where they experience the culture shock. They can have depression, anxiety, And there's many factors that influence this. So it can be the student's self-awareness or even the length of time abroad. Again, these can come in many different forms. It can happen in short-term programs, it can happen in long-term programs. Some students don't experience it at all. Some students experience it really severely. So then this is just an outline of the W curve. So you can see pretty much mirror images, but on the new edition, that's when they return home. So this is an interesting concept as well, because maybe it's something that a student might not expect when they come home, that they're severely missing that previous culture that they had adapted to. So what we really want to address with this presentation is when you have a student who has a past mental illness history and they want to go abroad, when other students will experience a natural influx of emotions, a student with an underlying mental illness will experience a more severe and abnormal reaction to culture shock. So according to Dr. Bergra at the Institute of Psychiatry in London, they state that mental illness may come up from stress of immersing in another culture. This can depend on many factors such as personality traits and biopsychosocial vulnerabilities that can allow a psychiatric disorder to develop. The Journal of World Psychology outlines a phenomenon that travel can induce psychotic attacks, especially in travelers who have a history of psychosis. So it also states that many young adults may experience their first psychotic attack when abroad. A larger issue is people with a history of psychosis almost never search for pre-travel advice regarding their mental health. So these psychotic attacks affect about 1/5 of travel-related psychiatric issues. So when looking at a longitudinal history of IAU College, the company that I'm representing today, in a series of 7 consecutive study abroad terms, so this includes our semester, summer, and January term, there have been approximately 5 different cases of students returning early due to mental health reasons. This is actually quite statistically low. It's less than 0.003% of the IAU majority over the last 7 terms. Of these 5 cases, though, most of them had disclosed that they had a pre-existing mental health concern. So these students also reported they experienced signs of a relapse when abroad with their mental state. So now Jessica's going to talk a bit about culture shock and the crisis phase.
So we really need to be aware of how our students are reacting to kind of not only initial experience, but also looking at whether they've disclosed previously or kind of new experiences or new symptoms might be occurring when they arrive abroad. So as you all are supporting them and getting to know your students, I really think it's so important to have these conversations early on so they are open with you once they go abroad and they know who to contact. So we're looking at, is this more of a recurrent illness or is this something that is kind of emerging? So we know between 18 and 25 years of age, right, early adults typically have their first psychotic breaks, early onset of very severe chronic mental illness. So that's important to remember. We want to look for the behavioral changes that students are experiencing. So that's the sleep patterns, that's the attendance to class, that's maybe overeating or undereating. And you all are the ones that tend to know them best as you're preparing for this. You have many meetings, more so than many other people at their home institutions. So they're expressing negative feelings towards their new culture or surroundings of their community. Right, I'm not fitting in here. And many of these symptoms are also what we see as students are transitioning to the university, right? We know within the first 3 weeks of first-year students on a college campus is really when these symptoms really tend to arise, right? We hear their homesickness, I don't fit in here, everybody's smarter than me, I don't know how I'm gonna make it, this is so different than what I'm used to. So it's important that we're cueing into this and we're kind of keeping track of it as we're interacting with these students and having kind of eyes and ears open to these extremes, right? We really want to ask ourselves the question, is this something that I've heard before? As compared to other students in their cohort, are we seeing them? And we call them pink and red flags, right? If you kind of have those pink flags and you're thinking, this person is presenting very differently than I saw them in my office or the conversations on the phone or when we Skyped. Cue into those cues. You don't need a background in mental health to acknowledge that, and say something to the student. I think that that's the other piece of our message today, to be able to have this dialogue back and forth. Let them know you are concerned. Certainly any sense of hopelessness or failure, isolation, conversation. We want to hear for those cue words that our students are telling us. Typically, they give us a lot of cues within the conversation that sometimes we don't always pick up on that they are struggling. A withdrawal from friends or community members in the new culture, right? So this will be important to help understand how they're interacting with their host families. Are they showing up for class? Are they participating in different cultural activities and organizations and really getting involved in the community? And then looking at this kind of social media presence, right, which is new, and we're starting to look at that more and more. Check out the student's Facebook page. See if they've logged in to their email. Send them a message through Google, right? There's all these ways to interact with students and capturing kind of the social media piece of really helping engage not only where they're at, but seeing if they've been active on that, if they normally do so. So we want to really think about what we can do proactively to help these students set themselves up for success, right? We're really asking for a knowledge base. We want a baseline of what's going on for them. So one of the things would be, for example, the housing questionnaire, listing kind of general background about